Hello, dear colleagues. How are you? My name is Mynzhylky Berdikhojayev, and together with my assistant, Davlet Sembetov, we are from Almaty, Kazakhstan, Central Asia, Presidential Hospital, National, and we have this patient with multiple aneurysms. The first aneurysm on right ICA was treated with the stent assist coiling. It was a balloon assist coiling, and at the end we placed the stent. And at the same time we have seen the microaneurysm on the M2 bifurcation, and also two aneurysm on the ICA paraclinoid 1 and the supraclinoid 2, this one. As it's an unruptured incidental finding, but so many aneurysms and irregular shape, that's why we recommended the treatment. Now we have a Klimber 8 fringe, Neuroslider 27, and the Chikai Black. Zoya and Nazim are operating nurses, and Evgeny Grishayev today together with us. He is responsible for the live streaming, and okay, now I'm inside the aneurysm. I don't want to go there. I don't want to go to the aneurysm. Now it's more safer shape. As in upper branch the microaneurysm. That's why it's better to go to the lower branch. And as usual, the navigation of Neuroslider is quite complicated because the catheter is quite stiff. It's very stiff catheter. Even we gave the angulation to the tip of the catheter, which is 45 degrees, and now we stuck at the ICA. Yes, it's a difference between headway phenome and the Neuroslider. That's why I need to go up. Yes. Okay. Yes, nowadays we have a problem with all instruments. That's why smart mask. Вперед. Yes, and the situation will not be the better this year. That's why we should work in this condition for a long time. That's quite stiff catheter. Yeah. The navigation is painful. Yes, now it's better. Yes, the microaneurysm in the MCA in the upper branch. Stent aspirator. Yes, and the only flow diverter available. Only flow diverter available on the shelf is the headway Berdikhojayev Heel 2. The size is 4.525. It's only the size. And the ICA diameter is 3 millimeter. Yes, also we have issues with the 17 catheters, that's why we didn't do coiling in this case. Кастрат. Все, и терю. It's 8 left. Salim Astronom. Yes, Bachat came, and Жанна is anesthesiology nurse. She is in the operating room. Okay. Now we will change the working position on the 3D. It's a 38 left and 5 cranial. Basement response. Basement. As patient premedicated with ticagrelor 180 milligram, and we didn't do test. The resistance in our population is approximately 1% for ticagrelor. It's very low percentage. And because of the situation, we are doing testing only for clopidogrel. The resistance rate for clopidogrel is approximately clopidogrel is the resistance is 26%. Yes, there is a spasm. Yes, in this case it's possible to give some nimodipine because of the size of the vessel, but after the operation usually those patients has headaches. That's why we try to avoid giving the nimodipine in flow diverter cases. Okay, I think now it's correct. The size of the stent like a ICA size, but on lateral view we're still in the MCA. No? Yes, we're still in the MCA. Stop. Minus. Okay, now in the ICA. The stent is nicely opening. It's a second generation Berdikhojayev Heel 2. Yes. I think it's okay. Oh, it's okay. It's at the level of choroidal artery. Yes, it's a little bit in the choroidal. Okay, now it's better. I think we again pushed a little bit the stent. It's still in choroidal segment. Okay, let's move the stent a little bit proximal. Just lower it up here. It's pushing forward. Yes, it's pushing forward. I see it's nicely opening. As it might a little bit angulate and twist because of the size. It's a problem, huh? It's all the time problem with bigger diameter stents. Okay, let's confirm that the distal part is okay. Yes, we're mostly focused on AP, but I think the lateral is better. Yes, it's open now. Okay. It's open, but it's a little bit narrow. And I'm talking also. Now we'll go for massage, and maybe we'll need an angioplasty. It's too long stent, 25 millimeter. But the problem is we couldn't have a big stock. Okay, I think we will finish with the angioplasty. Yes, it's twisted. I know. It's going, but it's twisted. And also the catheter is very nice. Now we are outside. Okay, let's start opening. It's okay, it's okay. Now it's better. But I think we need an angioplasty, yeah? Так, она же қанша болды? 3 қой, да, где-то? Или 3,5 ба? We have a problem number 2, the limited number of stents and balloons. Just a second. Zoya? Брзион блюашпер и баллон Şarmda toz. Şarm toz. Nereden ölçüsün diametre? Yoktu. Я сужу ölçüsün. Şarm bu. Шприц пятерку алсал, индифлятор керек жоқ. Пятерка шприцпен үрлей саламыз. Yes, we ask for coronary balloon Asahi Camus, which is Duvan, and for the coronary wire, which is the Xeon Blue, the most popular one in the department. Yes, now Почта. Okay. Шприц пятеркаға қазір. The size of the balloon is 3.5 by 9 millimeter. It's a standard size for the vertebral artery and intracranial interventions, for the chronic stenosis, occlusion cases. Yes, it's not the narrow balloons, that's why the situation is like this. I couldn't push my display. There is a problem. There is no support for guiding. Yes, the most part of the stent is already opened. Yes, the stent is opened finally. Yes, it's fully open. The problem is we couldn't send the balloon. That's the problem. It's too much tortuosity. Okay. Now the construct is opened. Usually with the correct size, full range of instruments, it's quite easy. Okay. Zoom. Включи. И минус хорошо. Вперед. Okay, it looks like it's okay. It looks like okay. And now you can see nicely the microaneurysm in the MCA territory. This is the microaneurysm. We will follow. Maybe it's possible to place a short Leo baby 2 mm by 12, and the distal part is opposing. At this part, it's aneurysmal segment, maybe a little bit non-opposed, but the proximal part is fully opposed. Yes, it's fully opposed proximally. Yes. Now we can finish the case, and okay, let's do expert CT. Let's wait for results of expert CT. Ойдах да стентimiz орнuna turdu. Қазір бітіреміз. Okay, dear colleagues, CT is ready. Now you can see the stent. Distally is fully opened and the brain is clear. This is a previous intervention. I think it was Pegasus stent. It looks like Pegasus. This is Derivo and this is Derivo. Okay, let's play with. Yes, somebody is calling me. Yes, everything's okay. Next case will be brain AVM, and I hope to see you in 2 hours. Now 9 AM in Almaty, and we're expecting to start at 11. And it will be Vino success, and live streaming for the Moscow will start at 1 PM Almaty time. It will take some time to catheterize the venous site. Okay, see you in next 2 hours. Thank you for watching. Bye bye.